As the world commemorates the World Hypertension Day today, being the 17th of May, in order to raise awareness and promote hypertension prevention, detection, and control, we at Medicaicos join every other organization globally to reiterate the dangers of poor blood pressure control.
Hypertension is a silent killer and it is the main risk factor for the development of cardiovascular diseases. The World Health Organization estimated that about 1.28 billion adults aged 30 to 79 years worldwide currently live with hypertension. Of this said value, two-thirds of which reside in the low and middle income countries.
An estimated 46% of adults with hypertension are unaware they have the condition. Less than half of adults with hypertension are diagnosed and treated, about 42%. Approximately 1 in 5 adults with hypertension have it under control, making about 21%. Hypertension is a major cause of premature death worldwide.
For risk factors associated with development of high blood pressure, they can be grouped into modifiable factors and non-modifiable factors. The modifiable factors, there are those factors that we can control, such as stress, unhealthy diets, which might include excessive intake of salts, intake of diets high in trans and saturated fats, overweight or obesity, consumption of tobacco and alcohol, physical inactivity. While the non-modifiable risk factors are those factors that are beyond our control, such as age, sex, ethnicity, history of hypertension or family history of hypertension, and also those with a pre-existing condition such as diabetes or kidney problems.
Symptoms of hypertension. Most people with hypertension don't feel any symptoms. A reason it is called the silent killer. However, a very high blood pressure can cause headache, chest pain, dizziness, blurred vision, nosebleed, anxiety, and many more.
What are the treatment modalities? The treatment for hypertension can be pharmacological or non-pharmacological or both. The non-pharmacological method include lifestyle changes, lifestyle and dietary modifications, which might include things like cessation of smoking, avoidance of alcohol, regular exercise, avoid intake of trans or saturated fats, reduce salt intake, and many other lifestyle changes. While the pharmacological method involves the use of medications to control the blood pressure, the combination of these two modalities will give a very good blood pressure control.
Lifestyle changes, aside helping to reduce blood pressure, is also a significant preventive measures against hypertension. These include eating a healthy diet, low salt intake, weight reduction, be physically active, stoppage of tobacco, that's smoking, and also reduction or stoppage of alcohol consumption.
Other measures include taking your medications regularly, keeping to your doctor's appointments, regular home blood pressure monitoring, and effective management of stress.
Hypertension, especially uncontrolled, can cause severe damage to the heart. It can harden arteries, decreasing the flow of blood and oxygen to the heart.
Hypertension can cause chest pain, often called angina. It can also cause heart attack, which occurs when blood supply to the heart is blocked, thereby reducing oxygen supply to the heart, making the heart muscles to die off. It can cause heart failure, which occurs when the heart is unable to pump blood to other parts of the body and supply organs of the body. Irregular heartbeats can also result from high blood pressure, especially when it's uncontrolled. Hypertension is a leading cause of stroke, whether hemorrhagic or ischemic stroke. It can also cause damages to your organs, especially kidney and subsequent kidney failure.